I had a special and significant patient interaction this week. Um, this woman was in her mid 20s who came in looking for assistance with her acute anxiety and panic attacks. It was clear from the initial examination that the patient had a history of trauma, including maltreatment as a kid and a more recent traumatic experience that brought on her current symptoms. The patient's experience demonstrated the complexities of mental health problems and reaffirmed the value of taking a holistic approach to treatment, addressing both underlying traumas and the symptoms that are currently showing up. I became aware of the importance of empathy, active listening, creating a therapeutic relationship while handling such a delicate situation. When working with patients who have experienced trauma, it is especially important to build trust and provide a secure environment in which they can talk about their experiences. That connection and the patient's sense of understanding were greatly aided by my capacity to understand and validate her sentiments. I was also aware of my limitations throughout this exchange. Even while I could help, I might not have the necessary training to completely address the trauma. It was crucial to understand these boundaries in order to prevent crossing them and to use multidisciplinary strategies that include therapists and counselors with experience in trauma focused therapies. So I discovered the value of being present during the therapeutic process. After thinking back on this patient interaction, I validated her experience while being emotionally open to her and therapeutically non judgmental. The patient felt heard and supported. I'll use what I've learned in the future to improve my profession by building and developing active listening and empathy skills in order to expand my understanding of trauma focused therapies and work more effectively with other mental health providers. I will also pursue continued professional development in order to give patients the most complete care possible. I will also continue to be mindful of my own strengths and limitations and will be willing to send them to experts when necessary. So, overall, this experience has taught me the value of a compassionate, patient centered approach to mental health care and the significant influence of the provider patient connection. I'm determined to use this knowledge to improve my practice and give my patients the highest quality service.